My name is Dr. Amate, and Amate. I'm a physician. So a physician is a doctor for adults. So not surgery, not women's medicine or gyne, but anything else other than that. Physicians treat a wide range of things. So an adult patient, so usually anybody above 18 or sometimes even lower than that, if whatever medical conditions they have, so if they have like a pneumonia, malaria, other more complex things, thyroid disease, kidney disease, liver disease, any organ system, that's us. So autoimmune diseases, it's not one disease entity. It's a term that really encompasses a wide number of illnesses in there. So when you think about a disease, the body has its own response system, like a defense system to help attack whatever is attacking it. So those are called antibodies. Usually the body will produce antibodies. So in autoimmune disease, instead what happens is the body produces antibodies that are directed against the body itself. So sometimes the antibodies are directed against skin, against hair, which is really kind of skin, against muscle. So muscle comes in connective tissue, so joints, things like that. Sometimes it will be against glands, like the thyroid gland. Some are more multi-system, so you may have an autoimmune disease that attacks various organs at the same time. So it's a very broad set of diseases encompassed in that term, autoimmune diseases. Commonly we see, I'd say probably rheumatoid arthritis the most. So rheumatoid arthritis is a type of arthritis, so it usually will affect the joints. Most times the small joints in the fingers, in the toes, the big joints like in the wrists, the elbows, the shoulders, the knees, the ankles. So that's the one we would see most commonly. There are others. There's an autoimmune disease called inflammatory bowel disease. That's also fairly common. We see quite a number of patients with that. But in general, I think they're a bit more rare, so to speak. If I had maybe 100 patients, I might see 1 or 2 patients with autoimmune disease. So it's fairly rare. Yes and no. So they can be influenced by lifestyle in the sense of once it is diagnosed, there may be some things that you can do to help reduce the symptoms. So what we would call lifestyle changes that sometimes will help to reduce on the number of symptoms one is having. Can they be caused by the lifestyle one has per se? Not necessarily, no. They actually tend to be, I wouldn't say hereditary, but they are influenced by genes and how genes work. So it's not more of a lifestyle issue, it's more of something you happened to be born with that predisposed you to it. So autoimmune diseases, like we said, the body produces antibodies to fight a disease, but then these antibodies instead will attack the body itself. So where that process starts likely is from a defective gene from somewhere. So in the sense of, is it like something you get from somebody else? Is it something you can spread? No, it doesn't work like that. It's something you're born with, a predisposing factor, so something that can make you possibly get an autoimmune disease. And then later in life, from a series of events, then you will probably start having symptoms. Yes. Women in particular, we know women tend to have more autoimmune diseases than men. So if I had a cluster of patients with autoimmune disease, I'd find more women than I would find men. Although having said that, we obviously have quite a number of male patients who have autoimmune disease. But there isn't, how to put it, there isn't, maybe like you wouldn't say maybe just Africans or Caucasians. It tends to be a bit more widespread. So you'd find it in various groups of people. There are no quick remedies per se, but the quick remedies in that sense would be drugs that can be given to quickly bring down the symptoms. So say for example, a patient with rheumatoid arthritis will most likely come in with a lot of pain and swelling, joint swelling. So there will be drugs that we can give for those immediate symptoms. So when we're thinking about treating autoimmune disease, we do it in two ways. The first way is you will give medication to reduce on the current symptoms that a patient has. And then number two, to help the body calm down with the inflammatory process that is happening. So there are various drugs that can be given rather to help calm the body down a bit. Autoimmune diseases, there is really no way of preventing autoimmune disease because, like we said, it is probably determined by a gene somewhere. And not even just one gene necessarily, it's more like various, that an event comes together and then it brings you symptoms. So there is no real way of preventing autoimmune diseases. But having said that, when somebody has an autoimmune disease, they cannot necessarily be cured, but they can be controlled. So patients can live for a long time without disabling symptoms. We usually aim to have a patient have a fairly good quality of life, so they can go about their work, they can go about their family affairs and things like that with minimal symptoms. That would really be our goal at the end of the day. So autoimmune diseases can be managed. If a patient comes in with a certain cluster of symptoms, we will usually investigate them. We will listen to the symptoms they've been having, the period of time they've been having them. We will combine this with certain tests that we do, and then thereafter we'll make a diagnosis. So it's really important that a patient who has an autoimmune disease is seen in hospital, is managed properly. It doesn't matter which category of doctor sees you first, eventually they'll link you up to a physician, such as myself. Sometimes physicians will link you to even other specialists, such as rheumatologists. These are doctors who deal with joint and connective tissue diseases. Or sometimes they may direct you to see an endocrinologist. These are doctors who deal with diseases of glands. So it's not a very terrible thing to have. It can be managed. It can be managed fairly well, as long as a patient is taking the right medication, is following the doctor's advice, and at the end of the day, we'll have a fairly good patient.